This is the clinic I work out of. There's numerous beds and all the modalities are in the middle, which I'll be discussing about. For my Doing What I Do assignment, I've chosen to show modalities as it is something that I use quite a bit within my placement. So as a new patient comes in, typically 2 every half hour, we use modalities on them in order to help decrease pain, help create an anti-inflammatory response to their injury, as well as just to help them overall feel well, as that's the reason why they're in physio. So what typically goes is that the physiotherapist will direct me to use whatever modality they fits the situation, and they'll give us the settings and we just go ahead and follow their instructions. Soft tissue massage, I usually work into the neck muscles just to relieve some of the tension that's within the area, and I'll use some lotion in order to decrease friction. But when I come across a knot, which you can typically feel underneath the skin like a lump almost, you can friction on the spot, which creates a kind of a warming and a release mechanism, which you'll see within the video. Let me know if it gets painful at all. Shouldn't be more than a 5 out of 10. How's that?
Good. You probably do my right trap too.
You have increased muscle tone at the bottom of your neck.
Mm-hmm. That's probably why I have a headache.
Could be. It goes all the way down.
Mm-hmm.
Try and friction it out.
I think that whole trap is tight.
Yeah, you have a knot right there too. Breathe, like shrug your shoulders up and then bring them back down.
Continue that.
Sure. Do it again.
That's like my first rib is on that side is higher. I absolutely love when knots get released.
Yeah, you can feel them just subside.
Mm-hmm. I like doing it on other people and then on myself too. The kid that always did mine had like major claw pinching.
Oh no.
So he would just squeeze as hard as he could and it would give you a headache. You actually thought you were going to pass out, but my right trap's to the point where like I can't even really lean over on that side. It's painful.
Yeah.
I don't know if it's stress though. I don't know what I've been doing to have my head like that.
Well, we look down lots too.
Mm-hmm. Actually, this rib might be higher. That was hecka painful.
Oops, sorry.
No, you're good.
Do some traction.
I guess if your head, or you do your videos actually as long as you treat people, you'd have a solid 20 minutes. Like if you actually did the full 5 minutes of ultrasound.
Mm-hmm.
Seriously, I just want to strap a TENS machine to the frontal right side of my head.
Yeah.
It's in like one spot. It's pounding. I wonder if it is the weather today.
It's supposed to be a full moon tomorrow.
Really?
Could be it too. At the end here, I typically do some stretching. So I'll pull the head the opposite direction. I'll apply some pressure to the shoulder. And in order for the stretch to be effective, you have to hold it for about 30 seconds.
I feel like I have a nice double chin for the camera. Oh, frig, this side's tight.
Mm-hmm. This side's worse than the other side.
That one guy Jenna needled had a bent needle. I didn't even know you could bend like.
Yeah, if it twitches too quick or if you seize up.
Yeah, that's insane. I wonder if it'll ever split off though.
Don't talk about that. Alright. Cupping is a massage technique that I have learned to help with myofascial release. So it's kind of like soft tissue, but I am able to get deeper underneath the skin. What it does is it suctions the skin up and it allows it to decrease the pressure that's on the muscles. And so you can either do that in static, which is keeping it in one spot, which you may have seen with Olympic swimmers, stuff like that, or you can use it in motion, which is what I'm going to show you or demonstrate. Basically what it's going to do is it's going to create some blood circulation, which is redness that'll appear, and that's what you're generally looking for while it's happening. Feel a little more suction. There we go.
Scored a lot better on yeah. I think basically what I suggest is that we try a bit of a longer break and make sure that you don't feel because it gets to a point where we expect the progress to slow down a little bit. but we just want to make sure.
Oh
you
yeah, right over the
regress,
shoulder
right?
blade.
So that would be the main.
Oh, actually, both
thing is
infras are tight.
Take a
Oh.
take a 2-week break and see if you just made some slow, steady progress. That's kind of normal at this stage. If you saw a big drop in your status, then we might have to reevaluate that scenario. And if 2 weeks went well, then we can maybe consider. Like some people will come in and go, just at the tail end of that 2 weeks, I was feeling some stuff. So then we decided to stay at 2 weeks, but other people come in and go,
red. Your back's
I
just
felt
very
really good
red.
for that whole 2-week period. I was able to manage everything that was occurring, and maybe we try even expanding it a little bit, So I'm totally cool.
Before I hook up the IFC, I typically will get an ice pack out from the freezer, and I will put it in a towel and wet it so it is damp. This will create more of a cooling sensation for the individual to feel without the ice coming in direct contact with the skin and harming it. As I hook up the IFC, there's typically 4 pads. And so what I'll do is I'll place it in kind of a triangle or an X reaction so it can crossfire through the joint there where she's having the most pain. This helps decrease pain by creating a crossfire current to distract the neuroreceptors from sending the pain signal back up to the brain. The IFC current goes up and down in intensities that is decided subjectively by the patient. The ice is applied as a way to decrease inflammation and pain. Heat can also be used if patient is not acute or very aggravated. It's used as a non-invasive and less painful treatment method. It sends in light energy to help with nerve regeneration as well as to decrease pain and to help muscle growth. It is also an option for people that are very sensitive to pain and touch. We can use it statically, which is holding it in place, or we can do the painting method, which is when we move it over a small distance just to get a larger area. As we set it up, I have to grab the key as it is a safety thing, and I will put it in the machine to turn it on. When the machine's turned on, I make sure that everyone has safety glasses on. As it is a laser, we need to protect our eyes, and it is contraindicated to make sure that everyone is safe during the process of using it. We also ask the patient, and I know personally myself, not to look at the light as it could cause a reaction to your eyes. Ultrasound is basically high-frequency sound waves that are sent into the muscle to create a deep tissue warmth, as well as promotes blood flow to the area, which ultimately promotes healing. To use, an ultrasound gel is applied to the skin, and then the head is applied before you click start. Once you click start, you start moving it in a circular motion within the targeted area so it can heat that specific area as well as recirculate blood flow. Typically, the circular motion is done for the full 3 or 5 minutes, which is the length of this video, and all you're doing is making sure that there's gel still in the area and that you're keeping into where you are told to by the physios, as well as where the patient is having pain, and making sure that they aren't in pain at the same time. Part of every day of being in the clinic is interacting with all the patients that come through the door, so it's always important to make sure that you take your patient care to the next level and making sure that they aren't in pain, and if they are, it isn't typically above a 5 out of 10. Because as a kinesiology student, it's not your job to do any really heavy hands-on stuff, as that is the physio's job. As I have learned through my many days within the clinic and seeing many patients come through the doors, is just to be friendly and make sure that they're comfortable and always ask if they have any questions or issues, and typically it just makes their experience better as well as yours, and then you know you're doing your due diligence when it comes to patient care.